discuss today how is Therapy Lab changing what we've come to expect from traditional therapy.
Hi, well, thank you so much for having me. Therapy Lab is a new kind of therapy practice. Basically, we believe in making therapy more efficient for our clients and empowering our clients with innovation and just taking on therapy in a new format. This is our VR headset. I can tell you a little bit about it if you're interested. Basically, we use this for exposure therapy in our practice. Exposure therapy is a well-established treatment for specific phobias and fears, and it involves creating a hierarchy of baby steps where you gradually take on more and more challenges. Now, let's say you have a specific fear of something like public speaking, and your therapist says, hey, go give a talk to this group. You might think, well, no, I don't think my therapist is understanding how difficult that is for me. But when you give the client the headset and say, well, hey, okay, start with taking a look at this crowd in this headset and give that talk, it's a great way to get started with exposure therapy. So this is just one of the examples of tools that we're using.
Got it. And since we can't be there with you and try this on, what does a patient experience?
Well, we're working with a wonderful startup called Limbix from Northern California, and they are creating wonderful content. It's actual footage that you see in the camera, and you look all around, so you are seeing so many visual cues of the actual experience that you might be terrified of in real life. And what's really fascinating is there's a connection between seeing those visual cues when you're experiencing the event in the headset and your limbic system. So you feel all of those anxiety and panic symptoms when you're in the headset. We leave you in that space for about 20 to 25 minutes, and you process that experience while you're in the headset, and there's a subsiding of those anxiety symptoms. That's where the medicine is. That's where the intervention happens. You do that about 6 or 8 times, and by that point, you are ready to go out and try this in real life.
And what type of patient is this most applicable for right now? Is there a certain age demographic that you're shooting for, or is this immediately applicable to everybody and they can see an improvement or a difference?
That's a great question. This could work for anyone. It could even work for kids, although we don't see kids at Therapy Lab. It's really great for any age. What I will say, hats off to the millennials, because I think the millennials' interest in self-reflection and self-discovery and knowledge is really what's driving so much exciting disruption in the mental health industry right now.
Got it. And one of the most intriguing concepts, face your fears with VR as well. Is that a specific type of exposure in this experience?
What Face Your Fears is, that's basically the name that we give for that particular treatment package. So this is the Therapy Lab concept, is that we package our treatments based on a specific goal. And it's time limited, and so that's basically the name of our package for if you have any kind of specific fear. What's amazing about VR too is that you can get content from a lot of different sources on the internet right now. So even if you come in with a specific fear that you might think we've never heard of or is very uncommon, we can probably find the content and work with you on your fear regardless of what it is.
How willing are
we also, just since you asked about the packages.
Yeah, no, go ahead.
Well, since you asked about that package in particular, just to give you a broader concept of what Therapy Lab is, in addition to the Face Your Fears and phobia, exposure treatment that we also offer packages like the Unified Protocol for anxiety and depression. We offer help with relationships and friendship patterns, and then we also offer some wellness packages like positive psychology, adulting, just general treatment services that can improve your quality of life.
Got it. And I was wondering, for therapists who are maybe used to a traditional format of just in an office conversation, how willing do you think are they to adopt and try something new like this?
I think that's a wonderful question. I think there will always be a place for traditional therapy formats, but what we're seeing in our clients thus far is we've had a lot of interest and growth in our company And what we're seeing is a lot of first-time therapy users, or people, a lot of men are trying Therapy Lab because it's sort of a circumscribed, optimized experience of therapy that seems to appeal more to men perhaps. And also people of color, Asian Americans, African Americans are basically flocking to Therapy Lab because it's just something innovative and different.
And why do you think that is for this set of folks that you just described?
I think that there have been maybe some cultural barriers to entering therapy, and perhaps it seemed like it's for a certain part of the population and not for everyone. And then someone stumbles on our website and sees an innovative approach to therapy and says, "Oh, I kind of like that. It's kind of different." And our clients report to us that they get a boost of satisfaction and a feeling of even more benefit when they feel like they can complete the package. And that's not something that you've traditionally experienced in a traditional therapy setting.
All right, amazing stuff there. Dr. Chandler Chang is the founder and CEO of Therapy Lab.